excited for our podcast today to bring to you Dr. Bobby Elliott from Cary Pediatric Dentistry. I thought it would be helpful for us to remind our patients on how to take good care of their teeth, because even though in our office we still have the luxury of taking care of some sick and some well care, our dental colleagues are not in the offices for the most part right now. And so I just wanted to do a good reminder for everybody. Dr. Elliott is going to give us some guidance on a little bit of hygiene, a little bit of prevention, and then any other riveting teeth things that I don't know about. So welcome, Dr. Elliott. Thank you so much for being here with my families.
Sure. I appreciate you having me. Thank you for giving us the opportunity to share kind of what's going on and where we are as a community.
I love it.
Right now, it's tough because we can't be in the practice to help our patients. Personally, I didn't realize how much I took for granted of how much satisfaction I got from helping my patients and being with my team every day. And when that got taken away from us without me having any say in that, it was a huge disconnect. So we really miss our patients. We miss our team. We've been Zooming with our team members. And so I'm glad to have this opportunity to talk with the patients. So thank you.
Glad to hear from you. I think we just earlier today, I recorded a podcast on nutrition, and we were talking about all of the foods that most of us are going through in our pantries. And in some cases, some of the foods we're bringing home for comfort that we're not always in the habit of bringing home. So talk to me a little bit about just general hygiene and things that we want our families to remember that they may not be paying attention to as Easter comes around. And
Sure, yeah. We're in the middle of the 6 candy holidays that starts with Halloween, Thanksgiving, Christmas, Valentine's Day, Easter. So we're in the midst of it. I'm sure there's still a lot of residual candy that's left in the house. So if I can just say anything about this whole idea of minimizing cavities, potential for cavities, is just do the thing by brushing and flossing twice a day. One of the orders of operations I tell my parents is don't brush your kids' teeth when they wake up, because if you brush them at night before you go to bed, they've not eaten anything, and so you're not really brushing anything off. So focus on starting the day with clean teeth and then ending the day with teeth before they go to bed. Lots of things that are in the cupboard that you referenced that we bought for, or that we may have bought that we don't typically have. My rule of thumb is if you step on it and you have to peel it off your shoe, don't put it in your mouth.
Oh no.
That's a good one, right? Raisins, craisins, anything jelly, gummy, gooey, sticky. If you have to peel it off your shoe, don't put it in your, that's my take home.
Oy.
Remember.
That just ruined just every single Easter joy. So let's say our parents think you've lost your mind. What do they need to brush their teeth after they eat then? When can they have a balance of what they're going to do and not going to do?
So I tell parents, consider your child's frequency of intake. How often are they putting something in their mouth, or are they drinking something besides water? And when those teeth are exposed to the acids, the sugars, the carbohydrate, that is when the cavity process can begin. So if your kid's a snacker all day long, I would say try to brush 3 times a day if you can, after breakfast, middle of the day, and before you go to bed at night. And not to make this difficult, but just a wet toothbrush in the middle of the day can knock off that biofilm that causes the cavities. So you don't have to have toothpaste in the middle of the day. Quick wet toothbrush just breaks that biofilm up. If your kids are regimented, twice a day is gonna be good. But it's important, use your flosser, because any string that passes between the teeth, whether it's a floss pick or the actual string itself, is going to get that big stuff out of there. But if you don't floss, it's the biofilm, it's the sticky stuff that dissolves and stays stuck between the teeth that's the problem. So floss first, then brush. Get your brush out and make sure. People say, how long should I brush my kids' teeth? And I don't want to sound short when I say it, but brush them till they're clean, right? I mean, I can do that in 30 seconds, but it can take some people 2 minutes. So, on average, just try to make sure that you or somebody is doing a good job in your kid's mouth. And then finally, finish off with ACT fluoride rinse. This is the only one that has the clinical trials behind it. So this is the evidence-based rinse that we want them to use once a day.
Okay, I'm not doing any of these things. Start over. Okay, I'm flossing. Right? Okay, the whole time you're talking, My mouth is on my teeth. Like if you watch me on this video, I'm like, mm. So first of all, some parents ask me, because when we do fluoride in our offices, sometimes tooth hygiene comes up. And for kids, those little flossers are fine. You don't have to be getting in there with the big old.
It's hard to floss your own teeth, much less someone else's. So make it as easy as you can. This is what I use at home. So as long as there's string that's passing between the contact, that's what's getting that biofilm out there and getting that food dislodged.
And even the older kids should do ACT after their full mouth of teeth are in?
Absolutely. Any kid that can swish and spit, we're big fans of rinsing with this. But if your kid can't spit, dip the toothbrush in a little bit of it, and then you can brush it on their teeth so they don't have to have the ability to swish in order to get the benefit of the topical fluoride.
Now you're showing off. Okay. I'm going to go order that on Amazon. I'm not kidding around when we get back. I don't do that all the time. All right. So
it's an important thing.
If they do, okay. So, and the other thing I heard you say is that it's not just candy that contributes to you know, and obvious sugars, but the carbohydrates also do that biofilm as well.
That's right. So carbohydrate breaks down to simple sugar, and it's the simple sugar that feeds the bacteria in our mouth, and that creates the acid. So it doesn't have to just be like candy or something sweet that has the same potential as, say, a piece of bread or crackers.
Yeah.
That's probably a big point to take home. Crackers are as cavity producing as candy because crackers dissolve to a paste.
Even like goldfish too?
Goldfish crackers are horrendous for causing cavities.
You're killing everybody. I'm not going to be able to invite you back. It's a disaster. I'm kidding.
So well, let's go about what's a good option to use. So things that are wet and fleshy, like fruits, vegetables, even fruit in a can is good, but make sure you rinse it off because it's going to be packed syrup. Yeah. So just rinse that off, and that's okay. These are all perishable things, of course, but it's easier to get things in the middle of the grocery store where it's high sugar, high salt, that's in can, that's easy to go. The grab-and-go snacks we know are the ones that cause the most problems. Yeah. And it's sad that that's what America is. It's packaged for quick access, but it's high carbohydrate and just not good for our bodies. So, you know, if anything, follow up with a bunch of water. You know, that's the other thing too, is try to increase their water intake.
I want to ask one question that probably isn't just related to the pandemic, but I think is worth it to talk about since I have the luxury of talking to you. Can you talk about when the earliest is you should brush teeth? Sometimes I have little parents that have little baby ones and they look at me like I'm kind of nuts. And then also wondering just kind of like, they wipe it off with a toothbrush, with a towel? What do you typically recommend in taking care of those early teeth? Sure. Especially with respect to also bottle feeding and when to do it before or after that.
All right. So one of the things I try to teach our parents is to try to get rid of the phrase, they're just baby teeth. We know baby teeth grow in around 6 months old. All the way through 13 is when the last baby tooth typically falls out. So we can't watch a cavity at 4 or 5 years old between the back teeth because we've got 7 or 8 more years left on that. So the idea that we want to prevent a cavity from ever forming is through education and prevention. As soon as you see the tooth erupt into the mouth, average age is 6 months, we want you to switch from wiping the gum pad down to actually using a toothbrush. Okay. Bristles against the tooth is what's going to get that biofilm off, and that's what keeps the cavity from forming. The next popular question is, well, should I use toothpaste on my child who can't spit? And believe it or not, yes, we want you to use a fluoridated toothpaste, but the key is how much to use because we know they're going to ingest it. They can't spit. So the idea of the amount is super important. Old literature will tell you to use a smear of toothpaste. I mean, how much is a smear, right? So we've quantified that. It's the size of a piece of rice that we want you to use. So we know that through evidence-based research that if the kids swallow 2 times the amount that we recommend, so the rice size in the morning and the rice size in the evening, we know that that's not going to cause systemic problems or cause fluorosis. But if you use a pea size, or even that big ribbon of toothpaste that you see on the box, you know, that they want you to use that much product so you buy their toothpaste more often. Right. So don't be fooled. So never use more than a pea size, even for adults. But for who can spit the size of a pea, and the kids who can't spit, starting when you see a tooth come in the mouth at 6 months old, use the size of a piece of rice twice a day.
Okay. And then talk to me about bottle feeding and when you're supposed to discontinue that, at what time. Is it only when the teeth are finally there, and should they brush after as well?
Sure, great question. The idea behind
Breast, really, or breast, really.
yeah, so any milk source, let's just call it any milk source. Um, Baby bottle tooth decay was the old term, and that was because it was misleading. People would come in and say, we would never give our kid a bottle to bed. We give their milk to them in a cup before bed. And you realize there's a disconnect, that it's the actual milk that's causing the problem. So the new term is early childhood caries or any early childhood cavities, but the goal is to not go to bed with any type of milk product on the teeth. You want to go to bed with clean teeth. A lot of times my moms who are nocturnal breastfeeders, they will say, well, if I brush their teeth, it's going to wake them up. And so what I try to explain to them is, if you can just take a wet toothbrush and just quickly go around the mouth to get that matrix broken up so that biofilm start, that's going to be the key to not getting nursing cavities or baby bottle tooth decay or milk cavities.
Oh,
So the timing, I try to be very understanding of their nighttime process. And for me, I can just say, if you can just let them have milk out of a cup or a bottle before they go to bed, brush their teeth, and then let the milk work in their system to get them to drift off. But they drift off with clean teeth.
yes.
That's the key.
Yes. Yes. And sometimes I'll offer, if the parents are really reluctant, even to do a little water sometimes is a nice substitute, even though rather they have nothing, at least it doesn't sit as much on there.
So fine. Totally fine with water in a bottle going to bed. That's not a problem at all. It's what's in the bottle that's important. So let them have water at night or their milk before they brush teeth, then brush teeth. I'd have a lot of parents say the kids will try to bribe them into, Mom, can I just have one more drink of milk? And one little drink or a whole cup is going to activate that whole process of the bacteria in the mouth creating acid. So one little sip is just like a whole cup. You got to brush again.
Wow. Okay. All right. Thanks. I want to make sure we got in that. I've been meaning to share. I mean, I share that with a lot of my patients, but it's good to hear it from a dentist too.
Sure. Yeah.
So what I know to be true is that even though not all of our patients go to Cary Pediatric Dentistry, there are almost no dentists that I'm aware of that are able to do routine care. And so on behalf of your community, can you help our patients know when they really need to try and get in at least speaking to a dentist when it's an emergency?
Sure.
I don't want them going to the ER like they might if
Absolutely don't go to the ER.
Emergency. Sometimes they'll go with a tooth injury because it feels like a big emergency. And
Sure.
so when should they call, and what can they do to prevent injuries in a practical way, as we don't know when this is going to end?
Sure, absolutely. I'm happy to address that. The key is to keep any child out of the emergency room at this point, and the family. It's pretty rare that I would ever say to a parent to go to the emergency room unless it's a broken jaw, something very, very traumatic. But for teeth, let us be your first line of defense. Every pediatric dentist in this area shares a call schedule that we are in together. So please know that any child is able to have a connection to a pediatric dentist for advice. We will determine whether we need to come in to see you based on what you're going to share with us that the emergency is. The American Dental Association and the CDC has put out classifications of what is appropriate for us to come in for from an emergency standpoint. And I can go through those with you. Uncontrollable bleeding would be one. If a tooth is knocked out of the mouth and they cannot get the bleeding to stop by biting down on a gauze or even a damp tea bag, that is one thing to call us about. Any type of a facial swelling, or the fancy term is cellulitis, where you've got an infection that's bacterial based, typically because of a cavity or disease on the teeth, that's something that we would need to talk to you about. It doesn't mean we necessarily would see you, because we can sometimes manage that with antibiotics, but it's still important for you to call us because we don't want the infection to get into the bloodstream. The next one would be any type of pain that's not relieved with Tylenol or Motrin. And I would encourage parents to try one and then the other. Typically, one of those is going to knock out dental pain. But if you've tried both and you still can't get that relieved, then give us a call. If there is an appliance like a retainer that is glued in, that is broken on one side, it's sticking in the jaw or the cheek, that's something that we probably need to see, because you're not going to be able to get that out yourself. Yeah. You don't have those fancy little tools.
No.
And then the last one would be trauma on a graded scale, meaning call us and let us grade what's actually happening. The beauty of you being able to send us a picture on your phone means we can typically diagnose through teledentistry whether that's an emergency or not. I bet I can manage 75 to 80% of our dental tooth injuries over the phone without having to see them. So uncontrollable bleeding, a facial swelling, pain that can't be relieved with Tylenol or Motrin, some type of appliance sticking you in the cheek, or any type of trauma, give us a call. Don't go to the emergency room. Let us figure out what we need to do.
That's huge. Thank you. Thank you. Thank you. I love that so much.
Can I talk about prevention real fast on that?
I was just going to say, anything else you want to tell us about that is worth just putting in a pearl? I would love.
Absolutely. The goal is to prevent the trauma, right? So that we don't have to respond and you have to call us so that we can figure out what's happened. But the goal would be prevention. One of the most common places for dental injuries for younger children is in the bathroom. So remember, wet tiles are slippery. Put a towel down on the ground. Kids loved in the bathtub to try to pull themselves up on the side of the tub, and they slip and hit, and teeth get hit, knocked, broken. The goal, the response is put a towel over the edge of the bathtub. So when they're in the tub and they pull themselves up, there's a cushion of a towel over the edge. Those are the two main areas that we see most dental traumas for young kids. As they get a little bit older, it moves out of the bathroom and onto the wood floor with your socks. So either try to have grippy socks for kids so that they don't slip, or don't wear socks on wood floors so that they don't, slide into the corner of the table, which is a magnet for faces, And then as they get older, then things with wheels, skateboards, rollerblades, hoverboards, which we don't recommend. Those are all things that we see. Thank you. So prevention is key. So just try to avoid those areas, or put towels down to help cushion the blow.
Yeah, I think just really as a closing point, it's always good for prevention for both medical and dental care, but especially when access is limited, just doing what you can to do everything you can control to be able to minimize trauma and cavities and pain is probably the best bet for most of our parents until this period ends.
That's right. Absolutely.
I never thought I was going to miss my dentist.
I take that in the right way.
I miss my dentist.
We miss you guys. I'm telling you, it is something I've never experienced of not being able to go in and see my patients. It's been a really weird disconnect, but we're going to be back, and it's going to be okay. We're going to get through this together with patience and prayer and love. And we're going to get back to our lives the way they used to be.
Thank you so much for taking the time to speak to my family, my pediatric family, and to me. I greatly appreciate your friendship and also your expertise. It's really nice to chat with you. You
are welcome. I'm going to leave with just one more tip for dental pain that can be managed easily.
Yeah.
If kids do have small cavities that are starting between their teeth, oftentimes what causes those cavities or the holes is there's food stuck inside them. And so they just tell the parent, my tooth hurts, and that triggers the phone call. But if you can have them rinse first with, swish with water, or one of my tricks is if there's food stuck between the teeth where there could be a cavity, take your string floss and tie a knot, floss, and pull that knot through the contact. And that usually dislodges the food, which is the offending agent causing the cavity to pulse. So get the food dislodged, get the hole cleaned out with water and your toothbrush, and that can typically manage dental pain until we can get back in the office and actually get the cavity fixed.
That's an awesome tip. It seems like you're showing off a little bit, but it's still a really awesome tip.
I'm just trying to pass along the knowledge, baby.
All right, listen, stay safe, okay? Stay home, stay safe. We can't wait to see you again, okay?
Thanks, Hope. We appreciate you guys. Thank you.